Welcome to the Forum, live streamed worldwide from the Leadership Studio at the Harvard T.H. Chan School of Public Health. I'm Dean Michelle Williams. The Forum is a collaboration between the Harvard Chan School and independent news media. Each program features a panel of experts addressing some of today's most pressing public health issues. The Forum is one way the school advances the frontiers of public health and makes scientific insights accessible to policymakers and the public. I hope you find this program engaging and informative. Thank you for joining us.
Welcome. My name is Joe Neal. I'm a deputy editor on the NPR Science Desk, and I'm going to be your moderator today. Let me get started by introducing our panelists. On my immediate right are Bob Blendon. Bob is a professor of health policy and political analysis at the Harvard T.H. Chan School of Public Health here and the Harvard Kennedy School. To his right, Ichiro Kawachi. Ichiro is professor of social epidemiology at the Harvard Chan School. Ben Spohr is the manager of metrics and analytics for the City Health Dashboard Project. And on Ben's right is Catherine Newman. Catherine is interim chancellor of the University of Massachusetts, Boston. A few details first. This event is being sponsored jointly by the Robert Wood Johnson Foundation and NPR. We're streaming live on the websites of the Forum and NPR. We're also streaming live on Facebook and YouTube. We're going to have a short question and answer period at the end. You're invited to send in your questions. The email address is theforum@hsph.harvard.edu. So let me get started with a little bit of background on why we're here today. Income inequality in the United States is at its highest level in 50 years, according to the U.S. Census Bureau. Other research tells us that inequalities manifest in a variety of ways. However, Americans' perspectives on inequalities don't always match what science is telling us about these impacts. And that leads to a fundamental question: do Americans even see income inequality as a problem that needs to be solved? We're going to start our discussion today by looking at the results of a poll that was done by NPR, the Robert Wood Johnson Foundation, and the Harvard Chan School. The poll tried to get at some of the life experiences people have when it comes to income inequality. Once we've looked at the poll, our panelists are then going to look at some of the factors that generate and sustain inequality. And also, toward the end, we'll be discussing some solutions and approaches that may help address these differences. But first, let's look at a clip from a story that aired just this morning on NPR on Morning Edition. It's by our health correspondent, Patty Naiman, who's in Los Angeles. And it illustrates one of the findings in our poll. It shows how middle-class and low-income Americans may go without prescription drugs if their insurance isn't covering the drugs. The clip is courtesy of NPR, and you can go to npr.org or the Forum website to see the full results of the poll. You'll also hear in this clip from one of our panelists, Bob Blendon, from whom we will hear more very shortly. So let's roll the clip.
Sally Radosi is 78 and on a fixed income. She has severe acid reflux. Radosi is retired and on Medicare. She also pays for a supplemental insurance policy to cover the cost of drugs, but it will only pay for the generic version of her heartburn medication. Her doctor prescribed the brand name. She says the generic version just doesn't work for her.
No, it's not as effective. No, definitely not.
She can't afford the brand name, so now she has extremely painful episodes of acid reflux about 3 times a month. Our poll shows that, like Radosi, the vast majority of Americans have health insurance that includes prescription drug coverage. But 1 in 3 say that in the past year, insurance didn't cover the cost of medication for themselves or their household members. Robert Blendon with the Harvard Chan School directed our poll.
So what you see is insurers are not paying for some drugs that physicians are recommending and the patients think they need.
When that happened, most of the highest earners paid for the medication themselves. But Blendon says that was not the case for everyone else.
Half of the people who are middle class or moderate income are not getting them because they can't afford to go out and pay for it themselves.
Now, Bob, that was just one of the findings in our poll. Tell us more about what else we discovered.
So quickly, there's something unusual about the survey. This is about life experience, except it includes what is rarely ever covered, the life experience of the 1% wealthiest people in the United States. So what we look at, and I'll just show you very quickly, are some of the life experiences, but it's looked at the most successful in America and those who are not as well off. So let's take a look at the American dream, which if you watch the debates, no candidate can go 3 seconds without telling you about the American dream. First slide. So briefly what that shows you is that the top 1% are quite secure that they have already achieved the American dream. The thing, and this is what the discussion will be about, no other group thinks that they have achieved it, but they're optimistic it's possible for their future. And that's really what the discussion's about today. What would have to happen for that future to work out that way? Let me show the next slide, which has to do with financial satisfaction with your life. Now, recall, this survey went on in one of the best economic times that we've had. Low unemployment, growth. So you would think that people would be relatively satisfied. And as you can see, it's 87% of the top 1% and 38% of middle-income Americans and 20% of low-income Americans who are satisfied with their financial situation. So even when there is not unemployment and all these things are going on, there's something else affecting people. And then there's just a simple question you ask about, next slide, people's lives. If you had an unexpected bill of $1,000, for those of you who don't follow that, that's an auto bill, a house bill unexpected, or a medical bill which isn't covered by insurance. Would there be a problem paying for it? And all you need to look at the slide, it's 4% of the top 1% would be a problem, and it's 67% of the bottom, with over a third of middle-income people saying they couldn't pay unexpected. So this is a very good economic times. Let's just take a look at life's day-to-day just problems paying for things. Next slide. So what this basically shows on issues of medical bills down to food, that the top 1% barely face any problems at all paying for financial information, financial things they need. But for medical bills, it's very significant for middle and low income people. For food, it's quite significant for a third of low income people. Can't pay for the food they have. And it shows up even among middle class people. So, and you see problems of paying for housing, problems of paying for college. And so this is the wide range. When people think about these issues, they don't think in the aggregate, but they think about the problems they have actually just paying for this. And there's a very wide difference in life experiences. Though everybody hopes to have the American dream, they're having problems paying these bills. Next, and we'll do this very quickly. So, and this is where the discussion's going to come in. And then, since it's not NPR, I will highlight how the press can carry a finding completely differently. So this asks you, should this be a priority for the Congress to solve? Should it be a very important priority, a somewhat priority, not a priority at all? So what you found, and was covered completely different, is the majority of Americans at this moment don't think it's a very important priority to solve. But with the exception of upper income people, they think it's a priority. So without getting in the politics of the various media organizations, one media organization said, Americans don't consider this a priority at all. The other said, Americans really think this is a priority that needs to be solved. That's what the discussion's about today.
All right. Thank you, Bob, for that perspective. We're going to go from the macro view that Bob has given us to a more micro view and pick apart some of the things we found in the poll. And at Chiro, you study how income inequality affects health. How do disparities captured in the poll play out in your field?
Right. So I have been studying income inequality for 20 years, and I believe that the distribution of income in this country has become so skewed that it's reached the point of being one of the twin major challenges to population health, the other being climate change. In our field, health is an exquisite reflection of social conditions. And based on that narrative, in this country, for 3 consecutive years, we've had a decline in average life expectancy, which is driven by causes of death, such as opioid overdose, alcoholic liver disease, and suicide, which together constitute the deaths of despair. I think we're talking about literally a canary in the coal mine, which is telling us that something is very sick about the social conditions in this country. How that happens, I think, is because, as we just saw in the data, a plurality of Americans still subscribe to the American dream or think they're going to get there. But of course, data show that this country is less mobile than most other rich countries, and the situation has been getting worse. So that when the dream collides with reality, that results in frustration, people blaming themselves, and possibly to self-medication, whether it be through alcohol, tobacco, or even narcotic drugs.
It's interesting. We'll talk about some more of that in the discussion that follows. I want to turn to Ben now, and you're part of a project called the City Health Dashboard, and it focuses on the importance of geography and neighborhood in people's health outcomes. Tell us more about the dashboard and what we can learn from it.
Certainly. So the City Health Dashboard, cityhealthdashboard.com, is a data access website where you can look at the city and census tract level at over 35 measures of health and drivers of health for currently 510. As of today, 510 large U.S. cities will be expanding to 750 pretty soon. Most relevant to the current poll is that we have an income inequality measure on the dashboard. And we analyze income inequality along with many of our measures at the city and the census tract or neighborhood level. The idea here being that municipal-only or city-only measures often average over important variations in the distributions of health determinants of health outcomes across cities. When thinking about income inequality specifically, we have seen on the dashboard, and this is something that if you are a citizen scientist, you can go on the dashboard and look at right now in whatever city you're interested in, that income inequality often moves with other negative health determinants and health outcomes. As you were saying, Ichiro, these are not unrelated concepts. I think that in public health as a whole, we want to distill the story to one variable because it makes our science really easy, but these are multiply determined health issues that often have significant related sequelae. Thinking about life expectancy, as you brought up, we also see substantial differences or gaps in life expectancy within cities, sometimes up to 30 years at the neighborhood level. And we are currently exploring how this may be related to income inequality and other social drivers. So while we often think about income inequality at the macro level, the population level, and from the results of the poll at the individual level, there is also an important neighborhood context for the experience and the results of income inequality that I think is important for us to keep in mind. And I don't want to be too bleak here, there are some neighborhood-centered solutions that we'll talk about a little later that I think are really promising.
Yes, I look forward to hearing more about that. We're going to go a little more macro back now to the bigger picture. And Catherine, we've talked about how income inequality plays out nationally and within neighborhoods just now. Tell us what you've learned about how it expresses itself in the daily lives of people with low incomes. You've written books.
So I'm a sociologist who loves the qualitative side, meaning I'm interested in the daily lives of people, but I'm also interested in how those lives intersect the policy regimes they live inside of. So a number of years ago, I was asked to come down to Alabama to help campaign for the repeal of a food tax. In Alabama, food is taxed at 10 to 12%, which is a very, very high number. And if you are a low-income person in Alabama, that's going to take a huge chunk out of your income. What was interesting to me traveling out to rural areas of Alabama, so poor and so distant that they weren't even on the GPS, so we're talking about people living in trailers on scrubland that you can't find, is that they are facing higher food costs than virtually anybody else in the country. Because when they get to a store, which they don't get to very often, because these are people who can maybe go food shopping once a month, the kind of food they buy is the kind of food that will sit on a shelf for a month. And it's canned, and it's salted, and it's fat, and it's really bad for you. And as a result, you see huge obesity problems in rural areas of Alabama. But it's exacerbated by tax policy. In the southern states, there is a long tradition that dates all the way back to the post-Civil War period of floating the public sector on sales tax and other forms of regressive taxation. Very little in the way of progressive tax like property tax or income tax. So the public sector is floated on the backs of poor people through regressive taxation. And that hits them directly where their health lies because it affects their food consumption, it affects the kind of places they can afford to live because their income is so constrained. So what is really curious to me is that when you look at the country, at the map of the United States, you'll see this big block of southern states with very high rates of regressive taxation. And that turns out to go along with extremely high rates of morbidity and mortality, and not just among African Americans. The health profile of whites living in the southern states is terrible. Really bad problems of strokes and heart disease and so on. But also, along with those problems, comes school dropouts, teenage pregnancy, a whole series of social indicators that you wouldn't necessarily tie to tax policy. But with a colleague of mine, Rourke O'Brien, who's now at Yale University, we actually did a lot of quantitative work to see, well, how closely tied to tax policy, as opposed to other aspects of poverty, are these health problems? And it turns out there's an extremely tight connection between the two. But you see this in the daily lives of people who are so stranded and so isolated that their food habits intersect with low exercise, with extreme isolation, and with pure deprivation. So we live in very different policy regimes. If you look at the Northeast, where you will see a robust use, for example, of the Earned Incomes Tax Credit, so that poor people in the Northeast typically are getting refunds. Right? They're getting an injection of capital when they pay their taxes. But if you're in the southern states, it's the opposite. You're down below. You're paying tax. It's amazing to me that in 3 states in the United States, state income tax is subtracted from federal income tax. In many states, it's subtracted, or used to be. In some of these southern states, it's the other way around. Federal tax is subtracted from state tax, which means the people who are actually paying state tax are the people at the very bottom of the class ladder. These policies have an enormously determinative impact on the way in which poverty plays out. And we are seeing the consequences of inequality through those policy instruments, which have a very deep history in the United States and have had a particularly profound effect on regions like the southern states.
Thank you. That's a good point where we can turn now to our discussion and look at some of these issues more in depth. And I would just start by saying the poll found that that Americans kind of get that regressive taxation is not so great and may be a big problem. Although, of course, we have some disagreement in some media, as Bob points out. Tell us more, Bob, about what the poll found in terms of support for increasing taxes on the wealthy.
Without being sure that exactly relates to their problems, it's a recognition, and now shown through numbers of polls, that people think there's something wrong with the taxation levels at the top. And so, again, the only group who don't feel that way are the 1%. but there's some sense that these problems that people face in their lives require people at the top paying higher taxes to get at these other issues. And that has not always been the case for many, many years.
But we did find that 48% of the 1%, or half of the 1%,
Yes.
actually do support paying more taxes, that the wealthy pay more taxes.
Yes, and just not the wider majority seen by others.
Right.
Yeah.
Substantial support. Catherine, what about sales tax, property taxes? Those are the kinds of regressive taxes you're talking about. Are they different by region? I know in the Northeast we pay a lot more in property taxes.
We do, and there are very strong attitudes that are not always so helpful. So while people may recognize that more taxes need to be paid, the question is what kind. And sadly for the country, sales tax turns out to be relatively popular compared to progressive taxes, which are based on the ability to pay, basically, or wealth indicators like property tax or income tax. Why is sales tax perceived as the best kind of tax if you have to have one? Because it's seen as fair. So if I have to pay an additional 10% on a loaf of bread, and these poor people in Alabama I was working with have to pay the same, well, that seems like it's fair, except of course it's a massively larger proportion of their disposable income than it is for me. But going all the way back to the founding of our tax structure, sadly, sales tax and other kinds of regressive taxes, because they're all the same, and that goes, for example, for highway fees, bridge tolls, which are all, quote, the same for whoever's traveling over the bridge, but have a differential impact, that's seen as fair. Whereas progressive taxation, honestly, I'm not sure if we had progressive income tax on the ballot now that it would pass. There isn't a strong swelling feeling about progressive taxation generally, though that is perhaps beginning to turn a bit because there has been so much conversation about inequality.
Yeah,
honestly, I just think the attention that's been paid to inequality has made a difference.
Yeah, certainly it's been discussed in the Democratic debates by some of the candidates. Do you want to add something there, Bob?
Yeah, just what gets to be popular if you say that the tax increase only affects the top 5%. What isn't as popular is the point you say is we're going to have a progressive income tax for that, because then people get worried about what happens to the middle. But the thing that's there is this idea of a special tax for people who are in the highest bracket. That's what's taken off, but not necessarily let's spread the income tax per se across all the states.
Right. All right. Chiro, talk to us more about the relationship between persistent income inequality and apathy and despair, deaths of despair.
Right. So I think the biggest threat to the society from income inequality is that people who have, the haves, come to view inequality as being deserved, natural, and inevitable. When that level of apathy begins to take over, I think that's you get erosion of social cohesion, and ultimately all of the other effects of income inequality that have been studied by other social scientists, the threats to the functioning of democracy, as well as the death of the American dream. I think a lot of the problems of the people continuing to subscribe to the American dream is, of course, partly manufactured by misdirection of attention about inequality to, I've heard conservative pundits describe this as a case of envy and class warfare, which is, I think, frankly, a misdirection. It really isn't. It's a strange definition of class warfare when we're talking about the interests of the top 1% arrayed against the remaining 99%. That's I think, where the problem is. And that misdirection is not helping the national conversation.
Yes. I want to move on to the idea of intergenerational poverty. Poverty tends to be intergenerational. We know that from studies and over the years, and programs over the last 50 years haven't really seemed to make much of an impact to break the cycle. Ben, your organization's Purpose-Built Communities has had some success in this. Let's hear more about that.
Yeah, so as you point out, Ichiro, I think that it's really hard for people to wrap their heads around intervening in something that they at some level believe is a deserved and natural gradient. And one of the reasons that our project focuses on neighborhood level interventions is that it's hard to say that a neighborhood deserves anything. Nonetheless, disinvestment, crime, lower quality built environments, worse outcomes for the neighborhood inhabitants. Especially thinking about some of Jane Jacobs' work on what defines a slum. You know, Jane Jacobs reminded us that poverty and being a slum are not the same thing. So my organization is separate from purpose-built communities, but purpose-built communities is an intervention that that consults with cities in order to help them break the cycle of poverty and sort of lift places out of the sort of lower performing strata that we think of when we think of the consequences of income inequality. Their major foci are building mixed income but high quality housing, something that they call cradle to college education, thinking about especially things similar to New York City's policy intervention to increase pre-K, universal pre-K, and then working with communities to develop these interventions so that they're locally situated and tailored to the community's specific needs. And when looking at these sort of interventions that want to address large social problems, they by needs must be complex and locally situated, because what is necessary to turn around the consequences of income inequality in Trenton is different than what is needed in Compton. And so these sort of complex, locally tailored, long timeline and quite expensive interventions are sort of things that we need to use to address these issues.
We were talking about before we came in here the New York City program of pre-K for 3-year-olds. How long will it take us to see results like that? You talk about long term. I'm just curious. Because it's expensive, and if it doesn't work, it will be a lot of money spent.
Yeah, in my opinion, some of the other panelists can also speak to this. This sort of return that we see on something like universal pre-K will happen when the students who enrolled in universal pre-K graduate college, and they do not experience the learning gaps and the social cohesion gaps that people who are born into disadvantage experience. And so pre-K, I imagine it sort of as a really long-term social bond. If we were to sell social bonds for pre-K, it would be a 20-year bond, right? But the return on investment research that's been done on pre-K says you can get something like 80 cents back on the dollar, if not much more than that, for every dollar invested in pre-K. So this is, just thinking like an economist, everything we put into these long-term intergenerational interventions will bear fruit if we can be patient enough. But as we were discussing earlier, the timeline for these interventions doesn't always coincide with the political cycle, and that makes these things a gamble for policymakers.
May I just add to that? Although I think that's true for the children, I would expect to see more immediate effects in their families of better labor force participation, especially for women. The lower we move in the age band for public investments in childcare and education, the more likely it is that women will be able to keep their jobs. So there may be more immediate effects that are family and household based than the educational effects you'll see later on.
And do we think we'd see health outcomes improve?
Yes. Yeah, the evidence from randomized trials of early education suggests that in 20 years you do see impact on less obesity, less drug use. It has a number of effects that I characterize as strengthening children's ability to self-regulate, and it's a long-term investment. It's a bit of an irony because in this country, most of the policy discussions about education focus on the high end, such as expanding college and encouraging high school graduation. But all of the evidence from, whether it's from neurosciences, from child development and epidemiology, suggests that the most important investment is made at the earlier stages. The earlier, the bigger the impact and the more cost-effective it is.
But Catherine, I think you might also say that apprenticeships and technical training and good jobs with technical education are important.
Yes, they are. We have had a pronounced emphasis in this country on college and on white-collar jobs, and that's very important and very helpful. But there is a whole realm of high growth middle skilled jobs that we have not provided much of a training system for. And if you look at our counterparts and competitors in Germany, for example, or Austria, you see a huge investment in providing technical training, which is quite sophisticated. And it is a blend of apprenticeship, meaning on the job training, if you will, under the aegis of masters, or meisters as they call them, and classroom-based education. And that applies to 350 occupations in Germany, which are then subject to national examinations, and they are all the way from manufacturing jobs to healthcare jobs. This has provided a huge injection of an enormously well-trained labor force, probably the best in the world, but it also contributes to more income equality, because you don't have nearly the spread you do between white-collar professionals and blue-collar manufacturing jobs in those countries as you do here. And so I would expect that many of the consequences of income inequality are not as pronounced there because you don't have as much income inequality. But that takes a very considered investment in the educational pathways of 16 to 20-year-olds. And the U.S. used to have a system that looked a little bit like this, especially around the Second World War. And then we just dropped the whole thing. We came into the post-war period, and we were all about white-collar employment, and we just left behind every one of those programs. The last vestiges of them are in places like Aviation High School in New York, which more or less built the aircraft industry and the airline industry, or automotive high school. They used to be tied to these major industries. So we're starting to see some interest in this grow now, and as a way of providing, especially people who come from weak K through 12 education systems, an alternative other than just four-year college, which is not always so successful. This is a very robust possibility.
I want to go back to, you were talking about Europe for a minute, talking about there's more equality there. Is it all about higher taxes in Europe?
Well, it certainly higher taxes creates a platform not only of social investment, but of post-tax equality. But really the wage structure just looks completely different in a country like Germany, because they have so many basically well-paid, unionized blue-collar workers who have been trained through this highly productive system. And that's why, you know, they are the ones that have basically built the high-tech infrastructure all over the world. They eclipse our ability to compete because they've invested so much in this robust training structure.
We have a few questions coming in from online, and I want to turn to one of those now. And this is open to anyone on the panel. What advice would you give millennials who may not ultimately do better than their parents in terms of health and wealth? What should they be focusing on now to try to ensure a better future for themselves given these gaps?
They should vote for the right people.
They should vote.
For starters.
They have to vote, guys.
And they should be paying attention to policies like pension policy, which is not something that young millennials would be thinking about, but they need to because it's such a long runway.
Oh, it's not just a millennial thing. I mean, people when I was 30 years old were not paying any attention
No,
to pensions
you're
either.
absolutely right. But pensions are cumulative, and if you don't pay attention until you're elderly, you're going to be in big trouble. Mm-hmm. Pension policy, tax policy, housing policy, educational loan systems and so on, all of those things have a very big impact on them and on their children.
Here's another question from online. People can voluntarily pay more taxes to the U.S. government. Why don't we encourage wealthy people to do this voluntarily? Why do we need a formal taxation increase of the wealthy?
How much voluntary tax payment has anybody ever seen? We do have philanthropy, which is kind of a version of that, but it's certainly not required.
All right. Are there any questions from the audience, I wonder? We're waiting for a mic. Okay, here's one.
One of the panelists brought up Germany and the tax structure there. I'm wondering if the wage distribution in the country is done. Does that have anything to do with the racial dynamic of the country? Or because in the U.S. there's this tendency that a certain group is superior to the other and needs to be better financially, whereas in Germany it's a pretty homogeneous country racially.
Well, Germany, like many other European countries, has a fairly large immigrant population, a large population coming from Turkey, which is often in a somewhat analogous position to lower income racial minorities in the United States. I think what we're talking about really are big social policy differences, especially when we look at the Scandinavian countries, and others on the panel can talk more about that. But they manifest themselves in much greater investment in well-being from the earliest years to the latest years. I mean, in Sweden, if you are an elderly person, a state-paid health worker will check on you 6 times a day, and that costs you nothing except you're paying high taxes. But it's available to everyone regardless of their income. So it's a much more equal distribution of services. But Ichiro, you know more about this.
No, so in Sweden, what you get in exchange for the higher taxes that you pay is subsidized childcare to a maximum of $150 per month. You get up to a year of parental leave when you have children. You get free health care and essentially free college. So it really depends on each society how they want to arrange things. Do you want to pay less tax and have to pay for all these things yourself, or contribute to a common kitty where these services are guaranteed? And I think, as we could see in the NPR poll, substantial numbers of middle-class Americans can't afford their medication. College debt is saddling many middle-class families. Childcare is unaffordable for working families. We have a problem here between the choices that people make. And one other thing is, we have a wage structure also, which is at odds with labor productivity. There's been steady increases in labor productivity, which has been disconnected from the wages that workers receive. It's estimated that if we compensate workers for to actually reflect the rise in labor productivity, the minimum wage should be $22 as opposed to the $7.50, which is the federally guaranteed minimum wage today. So we have there's some policy choices that governments can make to close the gap between workers and the inequality that they confront.
$22 seems a long way away.
It's a long way.
Anyway, Bob, talk to us a little bit about the poll results on education. We found that the top 1% were less likely to believe students had a disadvantage.
So we asked about what it takes to be more successful. And it's hard from the results because hard work was number one, and a lot of what people call about social factors didn't rank as high. College education is one of the highest ranked, and if you want to just turn on the news and understand this, it's incredibly highly ranked if I'm a Democrat. It's much less highly ranked if I'm a Republican. For that. But what was interesting, a lot of social factors, whether or not it was discrimination, it was the neighborhood you grew up, people were not convinced that that was as big a factor in whether or not you succeeded or not. But hard work, college, people do acknowledge the friends your family has can influence you. But for a lot of things that people talk about at conferences, about this really affects that, people just didn't see it as a really major factor for going. So there's a gap in perception about why things may not work out between a lot of experts and what we found in the poll.
Interesting. Ben, you were, you can talk a little bit about successful, I want to go back a little bit to training and education. Successful education and successful GED programs and the importance of well-paying jobs with reliable benefits.
Yeah, so on the City Health Dashboard, cityhealthdashboard.com, we have a take action section where interested policymakers can explore evidence-based solutions or expert solutions to issues like income inequality. And if you look at the website, the resources for income inequality are also resources we might think are beneficial for quality of life in general, life expectancy, other social metrics. And they're interventions like jobs programs, or I do believe that we have universal pre-K on the list there. And if you think about it in terms of the interventions just in time, by the time we get to employment interventions that help people get jobs, a lot of times the folks who have been disadvantaged are not able to get well-paying jobs with benefits and whatever approximation of a year of paternal or maternal child leave we can get in the U.S. And so while those are necessary interventions that can improve the proximal consequences of income inequality, we also think that the longer term interventions might be and should be more beneficial. And so it takes a sort of a life course perspective to think about solving these problems.
I have another question from online. Can the continued belief in the American dream help explain the sometimes lack of support for entitlement programs? In other words, if you just work hard enough, you'll be fine. You shouldn't need so-called handouts.
I think it depends a lot on how the public thinks those benefits are being distributed or to whom. In general, Bob can educate us if I'm wrong about this. My sense is that if the benefit comes to me, then I'm okay with that program. If I think it's going to somebody that I think is socially suspect, then I'm not so keen on it. So it's difficult to disentangle the recipients of a benefit program from the feelings about the program itself. Social Security remains very, very popular. I mean, it's a third rail to touch it, as politicians have discovered. And part of the magic of Social Security is that it's universal and it's also progressive in the way it's distributed. Other kinds of social benefit programs are not so popular, and that's because of who they typically support. Is that a fair statement, Bob?
It is, but Medicare and Social Security, which are actually the two most popular federal programs, have another feature. You pay for it through your working life. People believe it. Now, it turns out if you're in government policy, you know that what people pay in never covers the cost. That's the secret. Why OMB directors need political asylum when they're through, because the average voter. But they believe they themselves pay for these two programs. They are much more negative if the programs are people who are not working or can't work for that. They're extremely judgmental about the basis. So subsidies, the income tax subsidies for working Americans is very popular. But anything that subsidizes people who do not work has a negative connotation in American politics. But if you pay for it through your working life, the reason why if you had an insurance program where people pay for it all the time, there would be less concern for when you're out of work, how your insurance works, than one where you're asking people to provide insurance to people who aren't working. So it's how it's financed in your relation to work, but we're very judgmental about this issue of work in the United States.
Hard work, yes.
Hard work, right.
You look like you wanted to add something.
No, I think that's absolutely right, and it's been an Achilles heel in the development of progressive social policy for forever.
All right. Another question from the audience, from online, from Tim. Does the panel have, and this is, I want to turn the discussion to healthcare specifically. Does the panel have specific statistics on the quality of healthcare disparities between the poor and more affluent, and how these disparities can negatively manifest in socioeconomically disadvantaged communities and individuals? Sharon?
I mean, the most obvious health inequality based on income would be access to insurance. And beyond that, I'm sure there are differences in quality of services received from local providers and in face-to-face interactions. There's considerable work that shows that these kinds of biases occur. But my main contention, however, is that the kind of problems I talked about at the beginning are not really linked to differences in access to or quality of health care. The American health predicament is not primarily a problem of health care. As a former physician, I can tell you that only about 10% of life expectancy in any given society is attributable to the quality of health care as well as the access to health care. Health care is very important when you're sick, but it's not a primary determinant of population health as we have been talking about this afternoon.
One other thing that I have in my notes here is the idea that one segment of inequality is caused by healthcare expenses leading to bankruptcy, and that was it still is a huge issue. It's certainly something Elizabeth Warren made
Yes.
her name on 10 years ago or 15 years ago. Can you talk more about that?
No, so universal access to health care is something that almost every other civilized country in the world has. I think access to health care is actually a fundamental social determinant of health. I mean, if you turn that around, lack of access to health care is one of the major or leading causes of personal bankruptcy. So I just think it's a given that we should begin with assuring access to health care before we talk about anything else.
But I think it's important to recognize, just following on Ichiro's earlier comment, that the distribution of, shall we say, burdens, physical burdens, dietary burdens, exercise burdens, is very dramatically impacted by inequality. I spent a lot of time writing my most recent book on retirement policy, looking, for example, at Teamsters, whose pension benefits were destroyed, just ripped away, really, and for a whole bunch of reasons, cratered during the 2008 stock market crash, among other things. But when you look at a Teamster who has worked for 30 or 40 years, driving a truck all night long on no dose to stay awake, eating at roadside barbecues where the food is pretty bad, these are people whose health is powerfully affected by the occupations they have. And so they have chronic back problems and chronic hip problems, and they tend to be overweight, and they have strokes at an earlier age. So the occupations people have dramatically affect the stress their bodies are under, the fluctuating income they experience, or the tension and stress that they find in their lives will drive bad health behaviors, smoking, obesity. Those things tend to be distributed in a very dramatic way by socioeconomic inequality. So all of those factors that Ichiro was talking about that are not really about health care, but are certainly about health behavior or health experience, are dramatically inflected by inequalities of all kinds: occupational, income, segregation, education. And that's why the solution to these problems doesn't lie specifically or not only in healthcare access.
And to add to the list of inequalities that you presented, on the dashboard we also have a number of built environment measures, and we were discussing this a bit earlier. We just added park access at the neighborhood level, which nobody else has, and then walk score and access to healthy foods. And so while income and your job, and especially fluctuations in income, really, I think that point is well taken, are so determinant of your health, also just the place you live and your opportunities to be healthy. Thinking about, is there somewhere to buy food near you? And if you can buy food, what is the quality of that food? And is it that the fresh produce is so expensive there's no way for you to eat the Michael Pollan's, like, don't eat too much, mostly plants thing? Like, that's not possible for a lot of the people, especially when we, in the socioeconomically disadvantaged neighborhoods, these opportunities do not exist, and so the people who live there may not have jobs that enable this, and they also may be exposed to negative built environment determinants that sort of compound these issues.
We've also learned that things like proximity to highways, proximity to toxic exposures, that, what rich person do you know who lives underneath a highway overpass? Nobody. So those kinds of exposures to toxic substances are highly inflected by inequality. So is social support. And we've learned a lot in the field about how having a rich friendship network to help you get through stressful periods is very important to health. We know there are studies that can show that people who are exposed to viruses come down with those viruses in differential rates depending on how rich and abundant their social networks are. But if you are a stressed single mother living in a very poor neighborhood, especially if you're in a rural area where you're very isolated, all of that stress is on you, and it will reflect itself in the wear and tear on your body. And that then leads to what I found in inner city areas when I was studying aging in the inner city, to the onset of chronic disease at an early age. So the kinds of diseases that wealthier people are familiar with when they're in their 70s begin occurring in your 50s. If you start developing heart disease or diabetes in your 50s, it will not only interrupt your labor market participation, but your children's labor market participation. So those health inequalities, which are driven by stress, will affect income, and it becomes a giant revolving circle.
I have a question from online about neighborhood social cohesion, and it prompted me to think about my own neighborhood in Washington, D.C., where on one corner, it's a gentrified neighborhood. On one corner is Trader Joe's, where many up-and-coming millennials and other people shop. On the other corner is a bodega that's been there for 50 years that has a large selection of wine and a large selection of canned and long shelf life foods. And the people who shop there are the people who live in the subsidized housing project across the street, and the people who, most of my block goes to Trader Joe's. So let me ask this question. Some research has suggested that even poorer neighborhoods can have better outcomes if there's good social cohesion. What are some factors that can help communities not only survive but do well despite obstacles to traditional factors that could lead to good health and wealth?
I just so much appreciate the person who sent in this question pointing out that rich neighborhoods don't necessarily mean good neighborhoods. And getting back to what I was saying earlier about how do we define a slum, we cannot define a quote-unquote slum neighborhood by income. There's a book, and the name of the author is escaping me, but it was about the big Chicago heat wave. And in this book, the author found that neighborhoods that had better social cohesion had lower mortality rates or just fewer deaths because people were checking in on each other. They were talking to each other about what was going on. They knew where the vulnerable person, when I say the vulnerable person, I mean the elderly person living alone in a place without air conditioning and maybe in a older building that's pretty stuffy, and that person may need their help and support. And thinking about a world in which I couldn't do this panel without my phone on the table, we're isolating more and more. And so checking on each other, building community is one thing, and then exchanging knowledge and exchanging ideas. During my doctoral program, I lived in almost every neighborhood in Brooklyn, and it was important to me to talk to people so I could find out where the good grocery stores were, because they're not always accessible in Brooklyn. And so I think that the specific factors that can encourage this are the people who live in these neighborhoods choosing to participate in the social institutions that we can all name but don't always participate in, like the community center, the YMCA, or going to the churches and meeting people there, which increases social cohesion and can help us not only when emergency strikes, but when we need to know things about the places we are.
I mean, the book is by Eric Kleinenberg. I've studied social cohesion in neighborhoods as a positive resilience factor for the health of people in America. I think it is important that this is a source of strength, but I also want to caution that there are limits to how much that can actually compensate for the inequalities that we're talking about. When you live in a deprived neighborhood and a cohesive one, you rely upon your neighbors for support and help, but there's only so much that poor people can do to support each other. And I want to point out that there are bigger forces which mean that inequality tends to worsen residential segregation and then erode social cohesion. So the erosion of cohesion in this society is partly a consequence of rising inequality. So we always have to look toward the origin of these problems. And much as I agree with trying to strengthen neighborhood social support, we have to also acknowledge the limits of that kind of strategy.
I think that's true, but it's also worth recognizing that sometimes we invest in certain institutions for a specific purpose that have payoffs that we didn't anticipate. So Mario Small's book, Unanticipated Gains, The Origins of Network Inequality in Everyday Life, look at child care centers, which obviously are there to support children and families, And he discovers that they are the origins of tremendously rich social networks that enable people to find housing and to navigate emergencies. That's not what they're set up for, but they happen to be places where social networks build if there are structures to the day in a daycare center that cause parents to be together for a period of time. There are also daycare centers where people are coming and going and they're not around and they don't build the social networks. So there are things we can do, and I agree with Ichiro, they will not be dispositive. They will not overturn a huge regime of inequality. But thoughtful construction of nonprofit organizations and the services they provide to strengthen social networks, create social support, and enable people who are facing, periodic insecurity to navigate it better than when they don't have them.
All right. We're getting close to the end of our discussion, and I want to ask each of you to give us some closing comments and tell us what your take-home message would be from our discussion here today. We'll start with Bob.
So something's happened recently in the area of the United States. We've had a group of economists who've gotten a great deal of noteworthy attention by focusing on inequality. At the same time, we suddenly find ourselves with presidential candidates talking about this. What's undecided and really affects the future is whether or not Americans who have financial problems link this to inequality or they link it to other problems in their lives. And that is not decided. And where that matters is if you're interested in big social spending in the future in a lot of areas, it really does relate to just what Catherine said, who's actually going to pay this. So, but this issue is unsettled. I have a problem getting a job, I have a problem with my kids' college. Is that due to anything else, or is it just due to what's going on? That's the question that's going to have to be decided over the next years in the U.S.
Ichiro?
I'd like the audience to keep in mind what I began with, which is that for 3 consecutive years we've had a decline in life expectancy in this country, which is unprecedented in peacetime, barring a major epidemic or a huge natural disaster. This is really telling us that something is awry with the conditions in this country. And I think we've talked about progressive taxation. I recall in the 1990s there was a presidential candidate who campaigned on a flat tax, flat federal tax. If it only were the case. I mean, we don't even have a situation today where the rich are paying the same tax rate as the poor or the middle class. They have a much lower tax rate than the middle class Americans, and that's an immediate problem that should be resolved urgently.
Thank you.
So I have a related request for the audience, which is that as my fellow panelists have discussed, it's easy to discount your lived experience as a product of your choices when you're living inside of your own sort of experience, your own mind. And we have the data that says this is not just you. Your experiences are not just you. We put this data on the dashboard. And so you folks here in the audience and watching at home tuned in today because you're interested in this issue and you probably know more than the average person. So my request, go to the dashboard. I have ulterior motives. Go to the dashboard. Check out what's going on in your city and your neighborhood. Look at how income inequality and other social drivers move with the negative health outcomes where you live, and then tell your friends and then vote. Because this is a policy issue that we can only solve by participating in the society that we're in. Go to the dashboard, tell your friends, vote.
So I'm going to wrap all the way back to some of Bob Blenden's important findings. I think inequality is a very hard language to propagate in the American context because in general our culture teaches that there's a degree of naturalness about it. And that means it sounds sort of like it's a positive Darwinian attribute, and of course it isn't. When we look at those periods of American history where a different language prevailed, sadly in some ways it seems to me to be mainly after wars. Because it's wars, whether they were the Revolutionary War, the Civil War, the World War II, World War I. It's during that period in which sacrifice is so profound and so widely spread that we temporarily, in the wake of it, forget about these social divisions and begin to recognize everyone deserves a pension. That was a Civil War invention. Or that you don't have to be landed to vote, which was a Revolutionary War intervention. So it's times of profound and widespread social sacrifice that tend to reverse this language for a period. That's a pretty sad comment. I would hope we could find better ways than wars to generate that sense that we are all in this together, because we pay a huge price, not only as individuals, but as a country. We pay it in productivity, we pay it in the costs of incarceration, we pay it in the difficult time we have ameliorating poverty. If we looked at what these social investments would do to save us money, I mean, even if you didn't care about the social justice issues, but just cared about whether or not it's cost effective to keep going with these levels of inequality, we know it isn't. And we only need to direct our eyes at other countries that have more rational policies to see that they spend a lot less on on the downside, if you will. So I think we need to search for other avenues besides massive military conflict to generate a sense that we are all in this boat together.
Well, lots to think about there. I want to thank you, thank all of our guests today for joining our discussion, and also people in the audience and people online. I hope people will take some of these messages into their own communities and create the change that's needed. I also want to thank the Harvard Chan School and the Forum staff for their outstanding work in presenting these discussions. They're all quite good. And to the Robert Wood Johnson Foundation for support, and to NPR for its continued support of covering issues that are central to our society's well-being. You can continue the discussion online at the Forum website, and you can see an archived version of this webcast later today on the Forum and on npr.org. Thanks again, everyone.
Thank you.